Good morning, everyone. Welcome to this session entitled The New EU Global Health Strategy, Opportunities for Research. Thank you for being here, and sorry because we are fashionably late. It's the early morning session. My name is Antoni Plasencia. I'm the director of the Barcelona Institute for Global Health, ISGlobal, and which is one of the founding institutions of ECTMIH, which I'll explain in a minute. And I'll be co-chairing together with Professor Anna Vassal, Executive Director of the Amsterdam Institute for Global Health and Development, also a founding institution of ECTMIH. And we are very pleased to have a distinguished panel of group of panelists. My co-chair will introduce them a little bit later. And before introducing our guest speaker, let me just, in a nutshell, explain why we are setting this session and why is ECTMIH involved. ECTMIH stands for the European Global Health Research Institute, European Global Health Research Institute Network. It was created in 2018 as a new network of leading global health research institutions in Europe, all concerned about the profile of global health in the European space, but of course related with the rest of the world and with our partnerships in the Global South. And with the main objective of, on the one hand, having an advocacy role to bring the vision and the commitment to global health to the EU Commission, but also to member states, so that's largely in the background of today's session, but also to promote greater interactions in research and in education between our institutions, which is also happened in these years. So, for those of you who are interested, you can look for us at the web, egrin.eu. The secretariat is at the Amsterdam Institute for Global Health. We have an elected board. I'm the chair of the elected board currently. And together today here, Alberto Rocamora, if you say hello, Alberto Rocamora heads the secretariat and provide you information. Let me thank also Professor Frank Kobelens from the Amsterdam Institute, former director and colleague at the board of ECTMIH for helping set this session, and also to Joyce Brown from the organizing committee, who has been really helpful in setting this. Before I introduce the speaker, let me just put an additional information on the context of this meeting. About a year ago, actually, I was just checking, I think it was late November last year, the Commission presented its global health strategy. And basically the message was, we have understood that health is something that goes beyond white gowns and hospitals and medications. We have understood that health is a geopolitical challenge, and therefore it's important that the European space has a specific strategy to strengthen the commitment towards equity. That's at the core, of course, of global health, and towards knowledge, towards research, towards education, and towards health systems response. So definitely that has been, it's been a year since then. And so now, today, it's a good opportunity to see where we stand, and specifically in the setting of this conference, to look at what opportunities, what challenges do we have, does the EU Global Health Strategy provide for the future and to our institutions and to our networks. Let me say that some European countries have been doing their homework in terms of developing their national global health strategy. This is the case for Germany. It's the recent case also for the Netherlands and for France. I have to say that for the case of Spain, due to the political elections, this was temporarily stopped, but hopefully there will be soon enough a global health, national global health strategy presented. So without further ado, let me just introduce our sketch noter, or note sketcher, I don't know, Jessamy. She, I think, will bring an additional dimension to our meeting here today, to our interaction, trying to go faster than our words, especially trying to help us understand some of the concepts that will be shared and will be discussed, because as we say, often say, an image is worth 1,000 words. So hopefully this will add a new dimension to this, to this interaction. So without further ado, let me introduce Dr. Jan Paller. He is a policy officer in the EU Commission, Directorate General for Research and Innovation. He's a physician with a doctorate in cardiology and a master's in health systems management. He has had an extensive experience working in Africa, both in clinical work, but also in other activities in African countries, and also in Europe, doing consultancy in areas of public health and global health, including Germany. So without further ado, Mr. Jan Paller, please, Dr. Jan Paller, please, if you can come to the stand. Thank you. Thank you.
Yeah, thanks a lot, Anthony, for the very kind introduction, and also to Frank and Anna for organizing this session, the ECTMIH for this wonderful conference, and Utrecht for hosting us here so gently and kindly. Yeah, I'm very pleased to talk about global health, and notably the global health strategy that has been adopted. And it already goes until back to November 2022, when it was adopted in the presence of the Director General of the WHO and the two commissioners for health and for international development. And it is a review of the previous global health strategy that dates back to 2010 and updates, of course, all the developments that have taken place since then. It was developed based on an extensive consultation process, both within Europe but also worldwide, involving different stakeholders and different venues for inputting. It clearly is in support of the Sustainable Development Goals and part of the key EU policies, both the Global Gateway for partnering with key partner countries and doing things jointly, and the external dimension of the European Health Union, which of course was heavily strengthened in the last 4 years since the pandemic hit. It's based on a health in all policies approach, so that it goes beyond clearly just the health policy, and it outlines, it's a proposal and a commitment from the European Commission, what can be done on behalf of all of us in Europe. But of course, we're still waiting for an endorsement of the member states, of the 27 member states, to also complement this strategy, what they will commit to in line of this strategy. So the strategy has 3 key priorities, and they are mainly taken cognizance of the fact that as far as the Sustainable Development Goals are concerned, we haven't made the progress that we have set ourselves to do. That of course has explanation through the setback by the pandemic, but still collectively we have only achieved a quarter of what is needed until 2030. There is still time to do, but this needs to be reinforced. So these three objectives, which are also in line with the strategy goals by the WHO, first, better health and well-being by regaining the lost ground on the SDGs, promoting drivers of good health, so not only treatment, addressing the root causes of ill health, and particular attention to women, girls, and people in vulnerable situations. The second one is advancing universal health coverage, and health coverage is, of course, UHC is a sub-goal of the SDGs, and very close to the hearts of European countries, which all operate different health systems, but are based on common values to have a universal access to good quality healthcare. And that goal that was also underlying the previous global health communication and the main input of European countries to the SDG process, of course, need updates. So we need more equitable primary healthcare system. We need better capacity to meet health emergency needs, and leveraging the digitalization and the research, which also requires improvement, and addressing workforce imbalance, both within Europe and between Europe and the world. And the third objective, of course, is based on the lessons learned, on the painful lessons learned of the pandemic. So the EU is pushing for new international rules and global surveillance systems, a permanent platform for development and distribution of vaccines, doing a One Health approach, so broader than just human health, and also addressing antimicrobial resistance. The strategy is based on 20 key principles that are outlined, but also makes a list of concrete actions to which the Commission is committing itself. So they go from setting up an integrated surveillance mechanism through at least the established new Commission department, HERA, the Health Emergency and Response Agency. Then also development of innovative medical countermeasures, also to address antimicrobial resistance and ensure that access is universal. Then support Gavi in the Vaccine Alliance in vaccine uptake and supply chains, roll out the COVID-19 vaccines to under-vaccinated populations and countries, which was most of the activity in 22 and 23. In relation to that, a Team Europe initiative together with member states have been established to support countries, but particularly in Africa, to boost their manufacturing capacity for medicines and other medical products. Research into vaccines and other will be, for emerging infectious diseases, will be supported through the Coalition for Epidemics Preparedness Innovations, CEPI. There will be contributions to the UNFPA Supplies Partnership to address female sexual and reproductive health and rights, contributions to the Global Fund to fight AIDS, tuberculosis, and malaria, and the WHO Universal Health Coverage with the European Union. The new pandemic fund has been set up and will be funded, as well as programs for training and recruiting healthcare workers, an EU Latin America and Caribbean partnership on health security and supply chains, and last but not least, the support to the third iteration of the Global Health ECTMIH2023 collaboration with Africa on clinical trials. So on implementation, the key part is, of course, the bilateral policy dialogue and work with partner countries. And here the program has broadened particularly involvement of health, not least through the experience from the pandemic. So 48 countries have a specific health program and collaboration and policy dialogue with the EU, worth 1.3 billion euros for the 7 years from 21 to 27. And 900 million of that, and most of the countries are going or are part of the partnership with Africa, while the single country receiving most of the funding is Turkey to support their health infrastructure as they host a lot of refugees, particularly from Syria and the Middle East. On the regional aspect, there has been now an EU-AU partnership developed on particularly for health. This is new, that there is a regional program between the EU and the African Union, and it is part of the Global Gateway and has 4 flagships. The one I already talked about was the rollout and the support to COVID vaccination. And related to that, the flagship to support local manufacturing and access to key medical products, including vaccines, which is part of the longer-term collaboration with the African Union and its member states and the new public health order in Africa and the nascent institutions of the AU, the Africa CDC and the Africa Medicines Agency. Linked to that, there are also Team Europe initiatives, so not only the EU, but also bilateral programs by the member states coming together to strengthen health systems, public health institutes, and pandemic preparedness and the digital agenda. And particularly to respect commitments from the EU, the African Union, and the regional economic committees on SRHR, there is a flagship to enable the environment for sexual and reproductive health and rights. And then the global initiatives, of course, feature strongly. So there have been great commitments to the Global Fund, 750 million from the EU for the current 3-year cycle from 23 to 25. It's a lot of money in absolute terms, but only 4% of what the Global Fund generally attracts from all donors. So the EU and the member states together account for 40% of the $4 to $5 billion that the Global Fund spends every year. For Gavi, the contribution was 300 million for the current cycle. For UNFPA Supplies Partnership for life-saving medicines, maternal health medicines, and family planning is 45 million. And the UHC partnership with the WHO, strengthening the role of the WHO in the partner countries so that they can advise governments to strengthen their health system. The contribution there now totals 272 from the EU. And last but not least, the Pandemic Fund, which has been set up in response to the pandemic to help countries better prepare for the next pandemic, is heavily financed by the EU, notably by the Commission. More than 400 million euros are coming to this initial fund. So that's about the general health programs, but now to research. There, of course, also with Africa, there has been a strengthened policy dialogue between the unions of Europe and Africa, and also the member states, where high-level policy dialogue between the ministries responsible for research are undergoing, and an innovation agenda has been agreed, which has public health as one of 4 key priorities, and 4 objectives are to make it real, so to translate the innovative capacities into tangible outputs, generate impact by design, to strengthen innovation ecosystems, and then strengthen people, communities, and institutions, and learn and monitor and scale it up. So it is high on the political agenda and to collaborate more on innovation between the two continents, and health features strongly. And one landmark action, of course, is the EDCTP, the European Developing Countries Clinical Trials Partnership, that celebrated its 20th anniversary beginning of the month in Paris. And it is the third iteration of what started 20 years ago, and has broadened both the membership of the partner countries who are working, namely 15 countries in Europe, 27 countries in Africa, to collaborate on clinical trials. And while initially the budget was smaller, 400 million for the first iteration as a budget, and the focus on HIV, tuberculosis, and malaria, the scope has broadened, the membership has broadened, and the budgets have broadened as well, so that we come now to a budget of at least 1.6 billion euros, where half of the money is coming from the EU, but depends on contributions from the countries of that partnership, both in Africa and Europe, to contribute 400 million, and other contributing partners like foundations, industry, other major funders to match the EU contribution. And here you see the partnership. So in Europe, it's 15 countries, and in Africa, it's 27. But the membership is growing very quickly, as you see the countries in orange or in bold in the text that have only recently joined the partnership. So we expect additional countries to come on board and benefit from this partnership. And as far as the research scope is concerned, the focus is on clinical research, but all the activities that enable clinical research are included. So both capacity building at individual level, so fellowships for senior and for junior researchers, support to regulatory strengthening, capacity building, and networking, whether institutionalized as network of excellence or the networking in projects. And the diseases are mainly infectious diseases, but, and now a new focus under EDCTP3 includes antimicrobial resistant and the climate crisis related diseases. The activities so far under the new Global Health EDCTP that just started last year. So 2 calls have been finalized to a budget of 230 million. 103 million have already been committed for 27 projects. And of those, 19 grants are actually research and innovation projects, including clinical trials and other clinical research. And 7.6 million in 8 grants are supporting the coordination, the strengthening of institutional capacities, and fellowships for individuals. So that's the EDCTP3. That is a collaboration between Europe and Africa, but there is the broader health program for Research Horizon Europe, which is open to the world. So we have research topics on various themes, including a large proportion to health. And this research is meant to stimulate collaborative research across borders in Europe and with Europe worldwide. So all the research projects can be also involve participants from around the world, and many countries are also eligible for funding. And individual researchers can always apply for fellowships or individual grants and are eligible for funding. So the easiest way, of course, to see whether you're eligible for funding is whether you live in a country that is associated to the program because of its attractiveness, and increasing numbers have associated themselves to the European Research Framework Program, mainly from Europe, but also Israel, New Zealand, Tunisia, Turkey, Ukraine. And Morocco and Canada are currently under discussion. But irrespective of whether associated or not, researchers from countries, from almost all low and lower middle income countries, are eligible for funding. And there is a specific list that lists all these countries. So meaning participants from low and lower middle income can participate in all the research proposals and projects and will receive funding from the program. So how is that operationalized? So there isn't, or there can be specific calls internationally, but the general approach is general research topics, which can also involve a remark that this is particularly suited for international cooperation. So in the topic text of the call, you may see flagging of call topics that are specifically relevant, and it can also be included as a specific eligibility condition. And if we look at the latest work program for 23 to 24, you see that for health, and there you also see the many other topics that the Research Framework Program supports. You have 53 topics for health, and of those, 7 are particularly suggested for international cooperation, which is 16%. But that doesn't mean that the other projects cannot also include participants from around the world. So that's it. Thank you very much. And here I've also listed a few websites for more information. Thank you.
Thank you very much. We have a few minutes for burning questions for clarification. Otherwise, Dr. Paller will join the panel, so he'll have a chance to also address any questions. I don't see any hands raised. Yes, here and there. Can you, down there, the microphone to the ladies who will take these 2 questions. And thank you for answering.
Thanks.
Yeah, good morning, thank you. I have a question about the first part where you gave an outline of all the money that has been granted to these different African countries. Could you say something about the strings attached? What is expected from these African countries in return? For example, the countries in the Sahel region.
I didn't hear you very well.
I have a question about what are the strings attached for all this money that is given to these African countries? Does the European Union, for example, demand that the countries in the Sahel region do something about the migration routes? Or, for example, like countries like Tunisia or Turkey, that they host a lot of refugees, that we don't have to do that, for example? Could you say something about that?
Yes. So the programs that I was presenting here are bilateral programs with each country, and they are based on a policy dialogue with those countries. And of course, health will be a major part, but the overall discussion includes everything. So, for example, with the agreement with Turkey, that was clearly part of a bilateral agreement to then to recognize the enormous burden that refugees are placing on the health system in Turkey. That there was an agreement between Turkey and the EU that the EU would contribute also funding to that, and it's part of a broader policy dialogue. So yes, so but strings attached, well, it depends on these agreements, but in general terms, there are none for the health program.
Thank you. second question, and then we'll move to the panel.
Yes, thank you for this informative presentation. I was interested in the climate crisis-related infectious diseases, which you mentioned was a great focus, which is very promising. I was wondering what the proportion is of funding and research capacity building for non-communicable diseases that are related to the climate crisis, like air pollution-related disease, but also mental health. I was wondering if is there anything you can say about that?
Yes. So, this part focused on the EDCTP part, and there the focus has always been on infectious diseases. And now, of course, it is possible to also research, to include research on the fringes, and the crisis-related diseases are there, also if there are comorbidities and so forth. But the decision has been mainly made to maintain the focus mainly on infectious diseases for EDCTP, mainly for practical reasons, because the resources are limited, and this is where the specific focus has always been. But that doesn't mean that the other areas have to be neglected, and they would then mainly be addressed through the broader Horizon Europe program, where these NCDs are addressed with proviso that international collaboration would be encouraged. So it is an overall priority, but would be a mix of instruments how they would be pursued.
Thank you very much. So, Professor Vassal, if you can join us and together with the panel, and we'll sit there.
I don't know if it can hear me.
Yeah, maybe they can come.
Can you hear me from up there? And if all the panel members would like to come up, but I think, okay, great, picks me up when I'm on the stage. So, good morning, everyone. It's very early, and it's great that you all have managed to make it at this time. We're going to follow up that presentation with a panel discussion. I'm going to introduce the panelists first, and then after that, there'll be plenty of time for you also to join in and ask questions too. So we're going to have a bit of a mixed discussion. So we're really fortunate to have our panel here today, and I just want to introduce them briefly before we start. So starting with Kerstin here. Dr. Kerstin Klipstein is an associate professor and a vice chair of global health at the Julius Center here in the Netherlands for health sciences and primary healthcare. She's an epidemiologist and nutrition scientist with over 25 experiences in international research, capacity strengthening and building in epidemiology and public health, with much of that including work in sub-Saharan Africa. So great to have you with us here today. Constance, Dr. Constance Asahu Luti works the World Health Organization in the African Regional Office. She was previously a staff scientist at the university in the Ivory Coast and has also worked in Europe together with the Tropical Medicine Institute in Germany and the Radboud University here in Nijmegen in the Netherlands. Irene Agathon is a leading thinker. She's a professor and a public health physician in the public health faculty of the Ghana College of Physicians and Surgeons. I think Irene, I'm sorry I'm going to be so humble, but Irene has been an inspiration for many of us working in health systems research for many, many years. So we're really grateful to have her here. And she's been the regional director of health services in the Greater Accra region in Ghana. So a kind of mixture between research and policy. And finally here, Lisa. Lisa's the head of the Brussels office and head of the EU advocacy at DSW, an advocacy organization advocating for development research and policy. She has a background in European public health policy and international human rights law, and she's worked previously for Amnesty International and the Green Political Foundation in Brussels. So a really mixed panel of academics, policymakers, and advocates. And we're going to talk about this. I'm going to sit down now so you can see them all properly. Jan, you've already seen. We're going to start the conversation by looking at what's changed, looking at what's different. As you saw, the original strategy, 2010, and this has been a revision post the pandemic, So I'm going to ask Lisa to talk and reflect about how that policy has been evolving over the years and what's new about this. Are we going to start to see anything different? So maybe over to you, Lisa, to start off and talk about that.
Thank you very much, Anna. As a civil society organization, also in coalition with other health-focused NGOs, we had been advocating for a revised European global health strategy for many years because the 2010 strategy was clearly out of date, neglecting major global health challenges. For example, AMR, sexual and reproductive health and rights, were not addressed in the previous policy. So we were really, really happy to see the new policy and strategy come about. But now we have to focus on the implementation. And for that, it was super interesting to see, of course, what Jan laid out, the funding that has been given. And while in absolute numbers, that might look very impressive, I think I want to highlight that if you look at EU ODA, official development assistance, and the percentage that is spent on health within that, the EU is still far away from what other countries, the EU is not a country, but let's say other national budgets spend, not in absolute terms, but in how they prioritize health within their ODA. And before COVID-19, we actually saw very, very few countries globally in their bilateral cooperation with the EU prioritizing health as one of the priority areas in international collaboration with the EU. This has changed now, luckily. And when it comes to implementation, I think we need to look at where the funding comes from. And because there's no particular funding attached to the strategy as such, but the EU has different instruments. One is international cooperation, so ODA, and the other one is research and innovation. And I think it's also important that there are no strings attached, especially when it comes to research and innovation collaboration, and it's really about scientific excellence and equitable partnership within those collaborations between the European Union member states and also, for example, Sub-Saharan Africa in the amazing EDCTP partnership. And the strategy recognizes the important role of EDCTP, which is great, and I think most of us in the room here know about the amazing work that EDCTP has been doing, but it's one piece of the puzzle, and we need other tools in the EU ecosystem to support and complement. So for example, when it comes to the EU innovation agenda that you mentioned earlier, one of the 4 priority areas is health. But then the calls that have been published so far in the Africa initiative within the EU Research and Innovation Framework Program Horizon Europe, there was no health-focused call so far. So we hope to see this change. And maybe one last thing, you mentioned also the health in all policies. I would like to say global health in all policies is what we need. And there's, some of you might know, currently a major revision of the EU pharmaceutical strategy going on, clearly a health-focused policy already, yet with no global health dimension in it. In fact, the current EU pharmaceutical strategy has kind of a recital that says that the EU should incentivize research into tropical diseases, and this provision has just been scrapped from the new proposal, which is now in negotiation in the Parliament and also in the Council, so where EU member states actually also have a really important role for this upcoming legislation, and we hope to see a global health dimension included back into this strategy so that we are not just looking at access to medicines in Europe and the pharmaceutical market in Europe, but considering global access also within this maybe more domestic policy area.
Thank you, Lisa. And in the new strategies, I understand there's more emphasis on local production of vaccines in Africa. Is that aligned, or do you see contradictions there? I don't know if there's been any, if you've heard of any, how those two things could work together.
No, I think this, everybody would agree that this is something that we need to focus on and increase local production capacities. And this is something where the strategy is very strong, aligning the different instruments and areas where the EU has influence. For example, while EDCTP, which is funded through the research envelopes, is funding clinical research and clinical capacities, but also regulatory strengthening, then in the ODA envelope, the work of the NDICI of the European Union, there is support in the Team Europe initiative, Math Plus, to manufacturing capacities, and they really complement each other. But I think we also need support to early stage research, so more health-focused support with LMICs, in particular our twin country, as the former commissioner said, Africa, and also other incentives, for example, new pull incentives that could be introduced now in a new pharma strategy, such as a European priority review voucher.
Okay. I don't know, Jan, I'm going to call on you. I don't know if you want to respond to any of those statements first, and then I'll move on for other interjections.
Yeah, well, thanks. I think I want to reiterate the point that Lisa made, that now it's part of a broader package. In 2010, there was the Global Health Strategy, but it wasn't overall prioritized, I would say, across the various policies. And now we have many instruments and policy initiatives that we could tag on, and where the implementation would make that sense. And the linking the production and the research is a classic example. The same for pandemic preparedness, which is now, of course, a global concern, but also across Europe. And there to bring in the various players, I think that is a great opportunity where we now need to make sure that all these sprawling initiatives really come together.
Great, thank you. Might come back to some of these issues later, but I want to bring in Constance from WHO Africa. You saw there was a strong link between the EU and the AU, the African Union policies. And I don't know if you want to reflect on that and think how aligned they are, and again, changes since the last strategy, whether things have got better and there's more alignment, or there are areas for concern.
So come again.
Sorry, on the alignment between the EU strategy and the African Union strategy, or the WHO Afro strategy, is there alignment, or are there differences there? And are there areas that could be built upon further?
Thank you. Thank you for your question, and thank you for inviting us here, speaking on behalf of WHO Afro. And yeah, to come to your question, definitely, there is a lot of alignment between what the strategy that EU has put forward, and the African Union, and also with the WHO. With the African Union has got a program which is entitled Africa's New Public Health Order. And it advocates a lot of things that the EU strategy wants to do, namely production, local production, and they're also strengthening public health workforce. And well, it talks also, there is also other aspect like strengthening, increasing domestic investment in health. So it is good that the strategy, the way it is built. Well, actually, I have to say the consultation phase maybe was good, because then you see that the EU strategy kind of feeds into what the African Union is doing. And I think this is going to be good when it comes to implementation, because then countries can really own it. So to come to WHO, which is the information, the entity I work for, there is great overlap between the policy framework, EU's policy framework, and what WHO does. It's really, there is a great synergy there. And then in the strategy, there is also this willingness to support the work of WHO. And I think this is excellent, because I think WHO, maybe we don't realize it, WHO does a lot in terms of capacity building, in terms of, in different areas. Right now, I'm team lead of the research for health. And I'm really amazed. I've joined the position 3 weeks ago. And I'm really amazed to see what they do actually with little capacity. A lot of people are working there, UNVs. And there is really, it is not enough. There is collaboration. There is alignment in policies, but I think we need more. And we need also to recognize that, well, WHO has got 3 levels: the headquarters, the regions, and then the countries. I am in the African, the regional office. And we need to recognize that we need much more support than headquarters, for example, because headquarters is much more affluent, let's say. So we need more support, and we have a lot of in research, for example, we have a lot of initiative. That we would want to develop, but there we lack capacity, and it will be nice to see how, after this meeting, how we can engage with Jan to to kind of support a little bit more the regional office in Africa. Thank you very much.
Thank you. And maybe, Jan, I'll ask you, there was a clear emphasis on supporting the WHO and some of the existing global bodies. Was that, why was that done? Why was that consciously done? Will that mean that 400 million, is that more than has been there in the past? Is this a real increase or just a statement of consistent support? And also, how do you see, because as you say, WHO is regionalizing, how do you see that money being spent? What's your sort of discussions with the WHO in terms of how that's aligned to your overall strategy of strengthening institutions?
Yeah, thanks. Well, I work for a regional organization, so we believe in the value of regional collaboration and strengthening the collaboration between countries in the vicinity. And we believe in a strong WHO, but that has always been our long before the pandemic, that we have to have a global body that can advise on health issues globally, but also at each country to help the countries for their stewardship for the health of their population, because ultimately it's the countries that are responsible for providing health care and other services. So that's why it has always been our aim, but the EU itself or the Commission is not a member of the WHO, so we don't contribute to the core budget to the WHO. So that's why this partnership, this UHC partnership, was established to strengthen the organization in what it does best and what it should do best at the country level, regional, and the global level. And when Dr. Tedros assumed his position as Director General, he actually said, I want to make this UHC partnership as the core of how we operate in WHO. So, but of course, our resources in absolute terms may look big, but when it comes down to each country and the regional level, it is not enough, certainly. So we need to do more, but our investment is in partnerships and for the longer term. That is where you can count on for when you engage with the European Union, and we're committed to that.
Great, thank you. And Irene, I just want to bring you in here. In terms of the overall shape of the strategy, we mentioned sexual reproductive health, but also this increased emphasis on pandemic response and surveillance. Do you think it reaches the needs of policymakers in lower middle income countries? I know that's a very broad category, so just maybe from Ghana or other areas as an illustration. Do you think it's aligned with those kind of interests, or do you see a difference between EU policy and what some of those countries really need?
Okay. Thank you, Anna, and thank you to the organizers for inviting me. I actually think the EU strategy is synergistic with the SDGs, with WHO Global Program of Work 13. I even looked at it and looked at the EU strategy. There are lots of areas for synergies. I think the problem comes when you have a strategy that tries to cover all your bases. And I think that's what this strategy does, which is great. But then in a world of finite resources, the crunch is going to come in implementation, because you may not be able to do it all. And I think that's where you may start finding the divergences, depending on how you go about where do I invest the resources. So And I would actually think that there's still that window, but it does involve a lot of dialogue and negotiation and talking. Because, and like you said, lower middle income countries are not one global aggregate. You know, there's a lot of range. So it does mean almost a lot of bilateral talking, a lot of openness, dealing with, you know, trust, mistrust, and so on. So it's not just the technicalities, it's also the politics of the whole thing. That would be what I would say.
And how do you, Jan, you know, I agree with Irene, you have this broad, maybe more of an emphasis on the pandemic and the threats area than previously, but does that actually affect the percentage of spend when you're negotiating with countries? How do you set priorities within that broad frame?
Yeah, well, in the dialogue with the countries, of course, we respect also what are the concerns of the countries, and we see ourselves from these dialogue that the weaknesses that have been exposed by the pandemic then need to be addressed, and also systemically for the longer term. So that's why, of course, at the moment, the activities may be more skewed to pandemic preparedness, but that is also has also benefited from the global discussion that more resources were made available particularly for that cause, because it was recognized we're in this together. We can only be safe once the pandemic is controlled everywhere. So, but of course, that interest is now ebbing away a little. So now it's really the task for all of us to see how we can best make use of the initiatives, of the resources that have been made available, so that we can sustain these programs in the longer term.
Thank you. Yeah, Lisa, come back in.
Yeah, and I think we also have to pay attention and make sure that this increased interest in pandemic preparedness, and we see it also in the programming of Horizon Europe, health work programs. HERA, the new EU agency for pandemic preparedness, is co-programming now also the health cluster. And it cannot happen at the expense of calls for proposals also on other infectious diseases, specifically poverty-related neglected infectious diseases. So we need to make sure that the EU, who is a great global health champion, still takes care of diseases that suffer from market failure and that in fact affect predominantly low and middle income countries, and not fall into the trap of being only focused on pandemic preparedness. And we have to consider that the multi-annual financial framework of the EU was conceived before the pandemic, and there was really very little interest in health. And luckily this has changed now, but budget lines that are meant to support multilateral health initiatives that were mentioned before, they were also conceived before the pandemic, and they are depleted now. So for the next multi-annual financial framework of the EU, we really need to make sure that these budget lines are boosted and that there's more investment in health research as well.
Constance, yes.
Yeah, I have a question for Jan. When I read the strategy, the new EU Global Health Strategy, one thing which really, for me, is promising and attractive is the concept of co-ownership. You know, having projects, but then pushing countries to invest as well. I mean, in your experience, do you see, we're speaking of limiting resources and a lot to do. There are many things that we would like to do, and then there aren't enough resources. Has this attitude kind of pushed country to invest a little bit more so that we can do a little bit more? Does it work?
Does it work? Yeah, well, we do hope it does. And of course, but it depends country by country, because we see many countries like in the Sahel where there's political turmoil. Of course, then it's difficult also to sustain programs both on the government side and from the EU side. But in general, because of that long-term commitment. We have 7-year funding cycles, so at least we can commit to programs that last at least 7 years or more. There is the way of engaging with the government, and of course for each program there is an agreement what the government will commit and what the EU will commit, and then there is check-in points along the way, because you can't plan everything for the future, as we have just recently seen. But in general terms, yes, we believe that this is very successful.
Yeah. Great, thank you. Yes, please, Kirsten.
Yeah, so the EU Global Health Strategy has really been long awaited. It's a comprehensive one, and it does hold a lot of promise. And actually then following up on your question on co-ownership, I think it is not only then co-ownership, if you do look at various European countries supporting it, but of course co-ownership then also with countries around the globe, and co-ownership also in potentially also co-financing research activities we would very much like to also see evolving. And I think, in that regard, I also support very much the question you've been putting forward.
Okay, well, actually, I'm going to follow up with you. So how do you see this strategy? So I'm going to talk a little bit about research and how academia and knowledge institutions can contribute to this strategy. So how do you think they can in Europe? And what do you think are the main directions the strategy is giving for the research agenda of the global health institutes and researchers sitting here? Kirsten, sorry, that was for you.
I think it is a very comprehensive strategy. What is also very good to see that is based on quite a number of guiding principles. Actually, 20 guiding principles have been outlined. I think at the core is very much then also of equitable partnerships and working together then also globally. And maybe this is then also a test for the strategy. It will require financial support, and we heard earlier on from Jan, it is unfortunately not yet ratified, and in part this then also depends very much on the individual European countries in how far they are also supporting that process. So there is, of course, also some there may also then be some additional influences into shaping this agenda, depending also on different ambitions and different strategies and programs in the various European member states.
And Irene, Lisa, please, no, step back in.
Yeah, I wanted to give one concrete example of what maybe everybody in the room could do, because when the EU develops, in collaboration with the member states, the work programs for the health cluster of the research framework program Horizon Europe, there are always consultations. And in these consultations, afterwards you can see who replied and what the recommendations were. It's huge communities of European-focused health problems, let's say, or industry representatives, not so much from academia, and even less so on topics that affect low and middle-income countries. So if there are consultations taking place on the work programs at national level, it's really important to get in touch with the health program committee members of your respective member state where you live, and tell them that it's important to have also calls for proposals on global health issues in the Horizon Health Cluster work program, and raise the voice. And that's something everybody can do there. That can be institutions, that can be individual researchers, but usually the member states really respect the recommendations from their own national research community. So that's one call to action for the room, to raise your voice in those consultations, that we can see more global health topics in the Horizon Europe work programs.
Yeah, and just to second that as well, I mean, you talked about EDCTP, which is obviously a flagship program, but also the non-clinical research. I think a lot of global health research, not just from people in this room, involves sort of interdisciplinary collaboration. I think the strategy highlights health systems, it highlights human workforce issues, things that go beyond clinical medicine. Is the only mechanism to get that kind of research to lobby Horizon and get it, or are there other instruments or research instruments that fall, that are global health focused, or is the only option to then lobby Horizon to get global health programs to get that type of research going? So I'm curious how you see that developing and how that alignment is developed.
Yes. So, yes, so Horizon Europe is a tremendous opportunity. To include that, and for that it would, first of all, I think, develop a compelling research agenda and how that fits to the aims of the strategy, which is global in nature and not only focused on Europe, and then making the case with those that decide. So in the EU, that's the respective member states, of course the Commission when the formal consultation also starts. But also, I would still advertise the EDCTP because it also has regularly calls on implementation research. So how do, that includes vaccine rollout, but also addressing hesitancy. So it's infectious disease related, but also covers health systems aspects. So if you look for it, you will find always opportunities to also do your collaborative research in the EDCTP. And in the EDCTP, that is really, particularly for the international collaboration, the wonderful partnership where the countries of Africa and the countries of Europe and the EU come together to define these research priorities. So it's a really bottom-up way of developing, and it's really a pleasure being part of that process. So I can only encourage everyone to contact their respective country, also if you're a researcher from Africa, and those, more importantly even, those that are not coming from a country in Africa that is part of the 27, lobby your government to join the EDCTP association so that you can also be eligible for funding from this wonderful instrument.
Great. And Irene, I was going to first hand over for you to also, go ahead.
No, I wanted to comment a bit on this issue of health security, because sometimes it appears, and I think some of it is a bit of the way we frame things and also our failure to listen carefully to each other and also try and be a bit imaginative and be the other person to understand where they are coming from. Because if you look at it now, I'll not talk about low and middle income countries in general, I'll talk about Africa and even more specifically West Africa, where I'm embedded, where the concerns are more about universal health coverage and the health systems. And I'll refer back to some of the work of the Lancet Commission on Synergies, where you actually find that to attain all these goals, they are not necessarily mutually exclusive. Let me use an example. If you look at the data coming out of COVID-19, where you have people already have problems with social determinants of health. They are living in lower income neighborhoods. They have more problems with non-communicable diseases, risk factors for non-communicable. They had worse health outcomes in the pandemic versus people in the same country who are in the different neighborhoods. And similarly, where you have better access to health systems, you may have better outcomes. The same way, if I take you back to Ebola in West Africa, part of the problem where you had an epidemic that went out of control was the decimated health systems in the countries where the problem started. You know, both Liberia and Sierra Leone were just coming out of a war. They are some of the poorest countries in the world. Guinea's health, and you see, the thing is that a lot of these epidemics and pandemics, they don't start in a well-resourced place. You do have exceptions. COVID started in Wuhan, it's true. But if you look across even the last 20 years, you are talking of pathogens that emerge. They take people by surprise. Now, if you had an even better basic health system in Guinea, where this problem started, would it have taken 3 whole months for people to realize this is what is going on? And in that 3 months, the virus had had time to go wherever it needed to go. And I don't want to go on, but I'm just saying that sometimes we need to stop a bit and think a bit more synergistically about our concerns. So your concern is health security. And in a way, universal health coverage is not such a huge problem in the richer countries. But the reality is that if you don't move the poorer countries closer to universal health coverage, we are all going to continue to be at risk. So I think we need to do a bit more of that kind of thinking systems. It's harder, it takes more time and more patience, and like I said, it requires you to put yourself in the other person's shoes. And it's 2 ways. Even for poorer countries, sometimes we need to also put ourselves in the shoes of the richer country and understand some of their fears and their concerns. It can be incredibly difficult. Maybe I'll stop here.
Thank you. And I think
Very well done.
so. Kirsten, Kirsten would head first, and the company.
So if we then actually take up this system thinking in a more synergistically approach, we would, of course, from a research perspective, and not only from a research perspective, also very much like to see that we could move beyond the EDCDP program. So that has a very specific focus, very much directed at a number of infectious diseases. But if we do look at what other challenges are out there, if we also look at the synergies that we do see and the syndemic that we see with non-communicable diseases, if we look around at this conference and then we hear about planetary health, we do hear about environmental aspects, then of course this would also call to use some of the tools and the experience that we've obtained over the years with EDCDP to actually then apply that to many, many more topics and really broaden up. And I think that would then also then very much call towards realizing this very nice and comprehensive EU global health strategy.
Great. And Constance?
Yeah, I just wanted to add a little bit something to what Irene said. I think it's right, it's really right what she's saying, but I think COVID-19 has taught a lot to everyone. And when I read this new strategy, for example, I mean, something which strikes me is the fact that now we realize that it doesn't always happen there. It's we are all involved in. So I guess I want to be a little bit optimistic in saying that slowly we are realizing that we need to invest in each other, to pull each other. So I think, yeah, it's something we will need to do going forward, and I'm confident we will go in the right direction.
Thank you, Constance. So I think now we're going to move to questions from the audience, but I think I was going to round, I mean, you heard what Lisa said about how you can take action, both in your research, but also in terms of lobbying. This is an opportunity. This is a new strategy. As you said, there are other countries which are now taking on, like Germany, the Netherlands recently has a new strategy as well. So there is a movement to action, but it's not quite yet committed with financial, and it seems like some of the instruments and the lobbying still needs to happen to make it happen and money go there. But I'd like to hand over to Antonio, who will lead perhaps the questions and answers for the audience and talk a bit more about.
Thank you very much. Thanks to the panelists. So now it's time for questions from the audience. If you can raise your hand, introduce yourself very briefly, ask one single question, and if this question is directed towards specifically one person, let us know, okay? So, any hands? I'm not very good at, yeah, out there, thank you.
Hi, good morning. Thank you very much for this excellent panel discussion. My name is Corinne Hinloop and I work for WEMOS, an Amsterdam-based civil society organization. I heard Dr. Pele say something about addressing health workforce imbalances in the EU as well as globally. I was very happy with that remark, actually, because I think that the health work imbalances and the challenges that we have in Europe have a knock-on effect on the global health labor market. But I was wondering, with the current rather limited mandate of the European Union on health workforce issues, and also the new European Health Union initiatives not really taking into account this kind of challenges, the health workforce challenges, how is that going to happen concretely? And I think this is an important issue also for our African colleagues to hear about. Thank you.
Thank you. Do you want to respond?
Yes, thank you. Here we come to a point that is a little where we still need to weight the commitment of the member states, because the global health strategy is now what the Commission proposes, and we're still waiting for the Council of the EU member states to make their commitments, because ultimately the recruitment and the retention is managed by the member states. And because of demographic change and higher demand and higher mobility of the workforce, there's of course a lot of demand for recruiting health workers from outside of your country, and that needs to be. And in the EU, there is freedom of movement, so there's little how you can regulate in this sense from the EU level. But the overall aim needs to be to increase training of medical personnel, particularly in Europe, that also lessens then the pull pressure from other parts of the world. But that will be a discussion that will be central to the discussion between the member states and then at the global level how we can do that. But training health workers, building capacity in the science, health science, and in health service provision is a key cornerstone of the development programs that the EU manages with partner countries.
Any views from our African colleagues on this? If you have any comments, besides what will already be said?
It's such a hard issue because, I mean, in Ghana, for example, we are losing nurses in droves. In fact, there's a whole ward which is in one of the regional hospitals, which is probably going to close down soon. But then you have the other side that it's a push and a pull. And I'm not trying to justify anybody, but just that, again, I think we need to sit down and think critically through it. Is it possible globally to have a bit more of an exchange, a fairer sort of system, where maybe we agree that maybe we do a bit of an exchange? So we need health workers, you also need health workers. How do we solve the problem together? Right now, it's a fragmented solution. I need health workers, I can pull them, I'm pulling them. I need health workers, I cannot retain them. Okay, they can go. It's I know it's a very difficult problem. And there's also the human rights of the health workers. People often don't talk about it that way, but sometimes in my own country, I ask people, yes, you want these health workers to stay. Would you post your daughter to some of the places you're asking them to work in? Because I've been in some of those places as a district medical officer, as a regional medical officer. It's incredibly hard, it's isolated. Can you solve some of those problems instead of telling them all to be altruistic and not go away? It's difficult, very difficult.
Thank you. So. Yeah. There's a question, the gentleman there. Other hands, so we can get prepared. One here. Maybe gender balance. Yes, another up there. Okay.
Thank you. Thank you for all this insight. And and really good to hear different voices and different perspectives. My name is Remco de Vru. I'm with Ligature, a foundation that supports public-private partnerships. One of the questions that I had on when the Horizon Europe program was presented, and I want to connect that to the discussion that is on planetary health, on environmental, on creating health itself. We always have the risk that we enter up into silos. And when I look at the Horizon Europe program, the actual environment or the climate is actually in a different program than the health. And I even haven't touched upon the food and the agriculture, for example, which also plays a very big part in to create health as per se. So here's my question. My question is, how does the European Union, European Commission take care of that? There is also an opportunity to do kind of joint programming, for example, in which you tackle all the different things. And then I'm touching upon the One Health, for example. So maybe some reflection on that.
Thank you. Over to you, Jan. We know you'll get many questions.
Yeah, no, a very good question, and of course that's an inherent challenge because we are organized in silos. Whether it's at global level, the UN organizations are there, the science maybe. So we need to push for more interaction, and of course the work program of Horizon Europe are done in the same process. So that's where we try to look and see where the topics that overlap may fit. But if there is such a topic, there's always a link at the other part. Maybe you want to look here to do that. So you work around something that is inherently difficult because it overlaps. One key issue, and with a collaboration with Africa, is this Team Europe initiative that will be working on One Health, that brings together member states and the EU and the partners in Africa to look at this specifically. But here again, this has been very slow to take up precisely because it's always difficult to get everybody into the same room, because you always have people working on one field and not maybe so related to the other. So it is a challenge that we see, and we're trying to address that, but it will not be easy.
Thank you. This is by the way, part of what we were discussing at AGRIN, because largely the money, the calls, the way they are designed, reflect a little bit what the two of you reflected or referred to. And basically, we want things to change. We have to be able to be influential enough to permeate these different areas of knowledge. And that's definitely a planetary and a One Health challenge for research and for training. So there was one question here, and then a lady up there. Okay? Yeah.
Thank you all for this very interesting discussion so far already. I'm a medical doctor trained in global health from the Netherlands. Yesterday we have had a very interesting talk about falsified and substandard medicine. I was wondering if one of the panelists can respond a bit more on that. The sobering fact yesterday was one of the presenters said that the recommendations in policy documents have stayed almost the same in 15 years. So despite these recommendations staying the same, not much has changed. Does any of the panelists know who can pick up this glove for innovative solutions to this a problem that has a big also planetary health impact?
No.
This
will be for the coffee time.
Substandard fake medicine.
And the impact of, because that's got the impact on health.
Or innovative solution of solving the problem.
Innovative solution. I mean, innovative solution, right now, I would not be, I cannot think, but I know it's a problem which is there is awareness, more and more awareness, and we have to hope that at a certain point that, raising that heightened awareness will lead to a solution. But right now, how to solve that problem, it's awareness. I know what WHO does is to alert people to what is happening. Look, there is this batch of medicine probably is not, this type of action are being taken. But other than that, yeah.
Yeah, go ahead. Yeah.
Yeah. I also think we need to invest much more in regulatory systems. The regulatory systems are really porous. If I use my own country as an example, the borders are very porous. There's the official border, and there are places where, and part of it is historically, you know, the countries of West Africa, like much of Africa, artificial. They were created at a meeting in Germany or something. So there are parts where there's a country, the bedroom is in Ghana and the living room is in Togo or Ivory Coast. It's so easy to smuggle stuff. I could go on and on. So it really needs a massive investment in some of these border controls and in the country regulatory systems. And there's also the poverty.
Yes.
Yeah.
Yeah.
Thank you. So one question up there. You can bring the microphone. And then there's another question here. I don't know if we have two microphones.
Thank you very much. I'm Aarti from India. And it's a pleasure to listen to each one of you. And it's a very enriching panel discussion. And I heard all the EU funding opportunities for the low and middle income countries, and which is so motivating. And I also saw the EU-AU, the collaborations that's planned for the future. So the pandemic was discussed, and what I like to bring to the platform here is India is ranked one of the low and middle income countries, but we produced 1 billion vaccines for the COVID-19, and we exported them also. So what I felt through these examples is that political leadership and political commitment is very important and very crucial when we are looking for collaborations. And my question to the panel is, I know there are policymakers, but should we stretch ourselves to make certain elements from this political elements also to see whatever the research and the innovation which we are planning through the funding that is provided to see the light of the day. Otherwise, just like what, I'm sorry, I don't get your names, but it's porous. Does it reach really the unmet need of the country is what I was wondering. So when we have this consortium, when we have this research group or the innovative group, should we have this leadership element so that whatever is researched gets to see the light of the day? I hope I made myself clear. Thank you.
Thank you. Do you want to respond to that? Please.
Me?
Yeah.
I'm not sure I heard everything perfectly because acoustics are difficult, but I think you talked about unmet medical need and how to make sure that whatever is being supported really reaches those in need. And I think the EU ecosystem of supporting global health is really complex. There are many tools, even beyond the ones that have been discussed today, next to Horizon Europe and EDCTP. There's also an EIB instrument for research and innovation on infectious diseases. There's early stage research through the ERC, and many other initiatives also on the ODA side. In the end, they all will have to play together, and it can only work if the priority setting is done in a equitable and collaborative way with partner countries in the global south. But yeah, it's really complex, and the definition of unmet medical need is also quite controversial. The current legislative project of the pharmaceutical strategy tries to kind of avoid, I think, defining it, but also because people have different understanding of it. I think from a development point of view, it's really important that public funding should serve neglected issues, so where there's market failure, because if there's no market failure, in some disease areas we have a thriving industry that addresses health problems, mostly concern high-income countries. So in my opinion, public funding should focus where the private sector is failing, and that is often, of course, in health issues that concern disproportionately low and middle income countries. And then those research priorities have to be defined together, and also with the stewardship of WHO, of course.
So I'm very sorry, we don't have time. We are in red time, and for once in a lifetime, will not behave as a Mediterranean, but as a Dutch. And I'll turn over the floor to close to Anna for any final comments you want.
Yeah, well, I have 23 seconds to do this, but I just would really like, I hopefully on behalf of the audience as well, to thank our panelists. I think we've had a great perspective, and I think there is optimism. This is a change. Economic conditions are difficult, but nevertheless, the fact that all these countries have come, the EU and the individual countries are coming forward to prioritize global health is a moment for us all that we should take up, but we have to continue to lobby for this and also lobby for integrated health research and integrated development investment in health systems. So I thank you all for listening to everyone, and I thank the panelists for inspiring us and educating us. Thank you.
Thank you.